from a scientific perspective, we don't find much use in this. You know, the game changer will be the vaccine that covers all the potential variants. And I know there's a lot of research being undertaken in that regard. But as for taking out a variant-specific vaccine, we are unable to provide any vaccine that will prevent infection. Even if we do have an Omicron-specific variant, it may reduce infections, but the variant will still evade antibodies, which do wane over time, as we know. It's the T cell, the cell-mediated immunity that prevents severe disease that is being maintained across the current vaccines. And, you know, in the situation where the world is unequally vaccinated, we should be focused on getting as many shots into as many people's arms as possible in order to overcome the emergency phase of this pandemic.
Because, Doctor, I can hear viewers begging me to ask you this question. Why would we have needed a Omicron-specific vaccine if in a couple of months many of us have to go back for our booster shot? The argument could have been, well, isn't the booster shot supposed to help with any kind of specific variants in COVID-19? There is an argument for that, isn't it?
Sure. I think that's a perfectly valid question. And, you know, I'll leave it to the companies themselves to try and answer. But at this point, the booster doses that you've just mentioned do provide sufficient protection against the Omicron variant without the need for an Omicron-specific vaccine. Look, I think we are, you know, and we may have different views about this across the world depending on different situations. But here, which is probably a standard example of how the pandemic is unfolding worldwide, we certainly can't see the need for that. We have very low rates of vaccination in the first place. So let's get the shots that we do have into people's arms. There is a big concern that we do have a lot of stock which may move toward expiry if we don't get shots into people's arms. So a redoubled effort in using what we have will be sufficient, especially with the booster, which has demonstrated a very effective stop to progression to severe disease and death.
Just tell me, Doctor, if you don't mind, where do you land on this debate around the sub-variant of of Omicron and COVID-19 that we were talking about a few days? We spoke to other experts, but now that I've got you on, if you don't mind, where do you land on this, Doctor?
Well, we know that these subvariants exist, and they are just, you know, slight mutations from the major variant that is identified. But the vaccines are specific enough to deal with the subvariants. So I don't think that's a concern either, for the same reason I mentioned earlier about having an Omicron-specific vaccine. And the subvariants occur with every variant that we find. And you know, you can't develop a vaccine for every subvariant and get people vaccinated. You know, there's also a concern that repeated vaccinations, like we're, I think, onto the 4th booster in certain countries, may impair immune responses. We don't have enough data on that, and that's not certain, but there is a concern already expressed about it. So best to go ahead with what we have. It works, it's safe, and it will get us to where we need to go, certainly for the next period. Last, I must say that we are entering a new phase of the pandemic. That is very clear. International expert and local expert opinion is converging on that view, that we will see in 2022 the exit from the emergency phase of this pandemic and move towards more endemicity. There's nothing certain about that, but that's the way things are pointed towards, and we can hope for that. So I think we are at an important juncture, and how we fight this virus through vaccination must actually encompass what we already have in the toolkit, rather than wait for variant-specific vaccines.